Are you ready to embrace aging with vitality and purpose? Welcome to Essential Wellness, the podcast dedicated to empowering women to live their best lives at any and every age. Join us as we explore the secrets to living and aging well with insightful conversations on health, wellness, and finding meaning, purpose, and passion in midlife and beyond. We'll delve into topics like stress management, finding balance, the power of movement, cultivating resilience, and so much more. Get ready to be inspired by transformative stories, expert advice, and practical tips you can implement right away. I'm your host, Dr. Mikel Segal. Let's dive in. Today, we have a very special guest, Dr. Tracie Paschke. She's a preventative cardiologist from Colorado. So welcome, Tracy.
Thank you very much for having me.
It's very exciting to have you here with us today. So tell us a little bit about yourself and what you do.
Yeah, so I'm a board certified cardiologist, and I've been in practice for almost 27 years now in all sorts of different practice settings and taking care of people when they came in with their heart attacks and heart failure and all the bad things, right? And after doing that for a long time, you realize that there's a lot that we could have done before people have those acute events to help maybe prevent those events, right? Or certainly prevent them from having another event if they've already had one. So over the years, that became sort of my passion, helping people prevent those events. So unfortunately, it's hard to have all those discussions in the traditional healthcare setting, right? So you might see a cardiologist, if you're lucky, for 30 minutes once a year, right? So, and in that time, we had to talk about your symptoms, your medications, how you were doing, and then let's talk about your sleep and your diet and your stress management and your exercise routine. And right, there's not enough time to fit all that in. So, so I decided to leave the traditional healthcare system and open my own practice where I don't take insurance in my practice, so I'm not, beholden to follow those time limits and do those certain things. So I spend a lot of time with people reviewing all those things, right? The pillars of lifestyle medicine and pillars of good health, because all that relates to heart disease, right? So it's not just good for your heart, but it's also good for your brain and your mental health and all of it, right? So all those same things that you talk to people about, but just from a different perspective. In Western medicine, we've siloed everything off, right? So you go see the heart doctor for heart things, and you see the GI doctor for fatty liver, and you see the endocrinologist for your elevated blood sugar. But really, all those things are related, right? And so it's good to take an overall assessment and picture of health, because if we can, for instance, if we can help someone modify their diet, their blood sugar comes down, their risk of cardiovascular disease goes down, their fatty liver can improve, right? So again, it's all related. So that's what I decided to do, to focus on more of holistic health.
Amazing.
Yeah.
And so it sounds like you've gone from kind of putting out fires, because that's what
Yes.
you have to do when you only
right.
have 30 minutes.
Yeah.
Manage someone's health, to sort of having a more holistic approach and really diving in and kind of preventing things before they become a fire.
Right. The putting out fires, that's important, obviously, right? When someone comes in having a heart attack, we want to help them survive that heart attack. But again, that's just a piece of the picture. And often that's how I explain it to people. It's two parts, really, right? It's the acute things. And again, Western medicine's very good at that, right? And medicine in the US, when you go in with a heart attack, the expectation is that you're going to survive that, right? With all the fancy medications and procedures and all that we do, right? so we're great at that, but it's the chronic part of it, right? So putting out the fire is one thing, but then how do we keep that fire from occurring in the first place, right? Or if the fire happens, not being so bad, right? So that's where prevention comes in. That's the piece. We spend more on healthcare in this country than any country in the world, but we have worse outcomes, right? And a lot of people, it's because we have this very high incidence of chronic illness. And so if we can, again, address all those things that contribute to that chronic illness, we can live not only a longer life, but a longer, have an increased health span, right? So our life is not just prolonged, but the time that we're healthy is prolonged. So that's what I focus on.
Yeah, I mean, you made some good points there in terms of health span. People don't want to, a lot of people say, I don't want to live to X age. I don't want to live to be 100. It's because people envision living in a poor state of health. And if we can
Right.
somehow find a way to, have people living, well and, independently and without pain, without suffering, then that might change people's mindsets.
Right.
Yeah, and the other
Yeah.
thing that sort of got my attention, what you said, is talking about sort of um, that interesting fact that, the healthcare system and, in the States especially, there's so much money that goes into healthcare and, fixing people's health, but yet, the numbers show that, Americans are not living, they're not living the longest, and, they're ending up, their lifespan is not what you would think, given the
Right.
amount of money that goes in. And so there's obviously some kind of disconnect there in terms
Yeah.
of, where the money is going versus how Americans are doing in terms of their health.
Right.
Yeah.
Right. And I think it's multiple factors that have caused that over the years. But the thing that I like to come back to is the American Heart Association estimates that 80 to 90% of cardiovascular disease is preventable with lifestyle modification. So
Mm-hmm.
that's a huge number, right?
Yeah.
And very empowering. Because
Mm-hmm.
I think that's part of the problem is that we've sort of handed off our health to
Mm-hmm.
other people to deal with, right? So, I mean, I remember, growing up, my parents, they smoked in the home, they smoked in the car, they ate, they didn't eat many fruits and vegetables, they didn't exercise, right? It was sort of a different, and then when they got sick, they would go to the doctor and expect a pill to make them better, right? So
Yeah.
it was just kind of a different mindset. I think now people are becoming more aware of the importance of, again, back to that empowering message that we do have a lot of agency over our health, right? We can do certain things to make our health worse, but also to make our health better, right? And it's never too early to start being healthy, and it's never too late. So, and just, kind of, I tell people to tackle it a bit at a time, right? Because it can be a little overwhelming. Well, you got to do this and do that, right? So
Mm-hmm.
I try to meet people where they are, sort of take an assessment of what they're doing in their life, right? Again, like you probably do as a health coach, and see where they're starting.
Mm-hmm.
And then how can we make these small changes? Maybe you change one thing a week or whatever. Maybe this week you try to incorporate more vegetables in your meals. Maybe next week you try going for a walk every day for 30 minutes, right? So just one small thing a week. And, in a year from now, you'll be a lot healthier than you were, right? It's going to
Yeah.
be slow change over time, but that's the best kind, right? Because that's how you incorporate these healthy habits into your everyday life. So you can be consistent with it and keep doing it because you feel good, right?
Yeah, so agree. It's so important to just meet people where they are and not take on too much at a time.
Right,
Yeah.
right.
So, if you don't mind sharing, I would like to hear a little bit about your personal journey in terms of what's made the biggest difference for you in terms of your health, especially around, mid-age, because I find women, they get to a certain age and they realize they're not feeling as well as they did in their 20s.
Yeah,
It's kind of reassessing your life at that moment. And I'm wondering
yeah.
if you if you can share a little bit about what happened, with you and if you made any changes and what made the biggest change, like difference for you.
Yeah, right. Because I think, especially women, right? We're busy taking care of everybody else, right? So we take care of our partner and our children and maybe aging parents. And when you're in the medical field, you're taking care of patients, right? So we have a lot on our plate. And then, again, you may be working a full-time job, but you're also taking care of doing the bulk of the stuff at home, right?
Yes.
Um, and so I think what happens, especially with women, is, I mean, and studies, they've looked at this. We're so busy taking care of other people that we forget to take care of ourselves, right? So I think what happens is we have this long to-do list and our stuff is at the bottom,
Mm,
right? Um, so what I would love is if, especially for women, if we could put ourselves at the top of the list, right?
mm,
Um, and then so when you put yourself at the top of the list, so your self-care. So that's multiple things, right? It's not just meditating every day, right? But self-care to me is all of it. It's eating beautiful, healthy food. It's moving more throughout the day. It's meditation and the sauna and the hot tub, and
mm,
it's reading a book for pleasure, all those things. It's painting or needlework, all the play stuff that we used to do that we don't do anymore, right? The creative stuff. So what I suggest is that and what I've done is putting myself at the top of the list, and then everything else I kind of do around it.
mhm,
Now, I can do that now because I've cultivated my life to match that, right? It's hard to do when you're grinding away in the, the system, right?
yeah.
Because the system doesn't appreciate those things, right? Um, so sometimes what I found is that my I wasn't living my life in accordance with my personal values. So the things that are important to me, like spending time with my loved ones and focusing on myself and my health, and teaching people about their health, I wasn't able to do that in the system that I was in, right?
Mhm.
And it just, I don't know, it became like this, Wendy Dean talks about moral injury, right? So it became this, it just wasn't, I didn't become a doctor to do that, to practice like that in that system, right? Um,
Mhm.
so again, I've purposely cultivated my life now to match my personal values and what I want to put in the world, right?
Mhm.
So, but it's hard, and again, I think women in healthcare, especially, as a physician, you start on a road to be a doctor and you just kind of follow the path, and it just ends up in a place where, like, wait, this isn't really this. I didn't want to do it this way, right?
Mhm. Yeah, you kind
Yeah.
of as you said, I think even early on, like even I know for me, it was, in undergrad university, you just kind of get on this track without even thinking. And I think as like as a 18, 19-year-old, you have no idea what you're getting yourself into.
Right.
I mean, I had no idea, and I just thought, oh, it would be, I think it'd be kind of neat to be a doctor, but
Yeah.
so then you start on this path, and then you're just kind of like almost like a, robot, or a chicken with
Right.
your head cut off. You're just kind of
Right.
going along the path, and then finally you end up, and you're like, okay, this is my life, so you better make sure it's set up the way that you want, and
Right.
you kind of, as you said, you have to be intentional about making those changes, like really kind of figuring out what's important to you and how you want your life to be. But it takes, like, you kind of have to, at first acknowledge that you're in, how you're living your life and what's not working for you or what is working for you. And
Right. And I think, we don't do that a lot, just to think about what we want.
hmm
Right. I
exactly.
mean, I certainly didn't do that when I was in my 20s, and I didn't do it in my 30s, or probably even when I started around 40, I think is when I started. Now, what do I want? Not what
Mhm.
do my parents want me to do, or
Mhm.
what does my husband want me to do, or what do I think I am supposed, but what do I want?
Mhm.
Right.
Mhm.
Um, and and in coaching, we, as you know, we do a lot of that work, right? Thinking about,
Mhm.
so what do I want in my life? What is my ideal life, right?
Mhm.
And that's actually how I started down this pathway. I heard a podcast, I don't know, it was probably 10 years ago, and it was about burnout, physician burnout. Before that was like, being talked about a lot, right? And the
Mhm.
guy said, write down what your ideal job would be.
Mhm.
And I thought, well, I don't know if I've ever really thought about that before, right? But it's the same thing like in life. You know,
Yeah.
when you close your eyes and you picture your ideal life, who are you with? What are you doing?
Mhm.
Where are you living? How are you making a living? And then once you get clarity on that, you can sort of build your life to match it,
Mhm.
right? And
Mhm.
again, it's not easy. And I know that I come from, a place of privilege, right? With the means to do that at this point in my life. But I think, again, if we think about it, we can all make sort of small adjustments to meet that. But again, it takes some intentional thought, right? You really have to think about, what are my personal values? I also think that's a very helpful exercise. What are my personal values, and what's my personal mission statement, right?
Mhm.
Like these companies have those values and mission statements that they may or may not follow.
Yeah.
But if you think about it from a personal standpoint, that's really where it's impactful. So then you can, anything that you think about doing, um, or not only in your personal life, but things that you do, right? So my one of my personal values is health.
Mhm.
And so when I'm going to do something now, I think about it in terms of, well, this good for my health, right? So,
Mhm.
but kind of back to that, the body's a temple, right? So if you think about it from a different mindset, sometimes it
Yeah.
just changes your perspective on things.
Yeah. Yeah. I love that. And I think, yeah, that, that sort of our midlife kind of offers us that chance to kind of to change our mindset a bit and to focus a little bit more on what is it that we want to create, and how do we want, like, what are our values? How do we want to live our life? And so I think it's amazing that you what you did and the changes you made, because as you said, it's not easy. It's not easy for anyone.
Mhm. Right.
And that you continue to kind of check in with yourself and ensure that you're living along the same your values and how you want to create your life. I
Right.
think, and you mentioned something else in terms of like envisioning your life, and I think for me also like just um, taking that time to know, like to think about possibilities, because I think again like that I love that word possibilities, because it's some like when we allow ourselves to consider the possibilities, like there's really, there's no end to what the possibilities are if you kind of just expand your mind in that way.
Right. Right. And if you think about the possibilities, our mind naturally, oh, I couldn't do that, or I couldn't live there. I don't, blah, blah, blah. And then you're like, well, is that true? No,
Yeah.
not really.
Right.
So again, once you sort of put it out there to the world, sometimes it's not as far-fetched as it seemed initially.
Exactly. And you realize you have all these beliefs that are limiting beliefs, but and then when you really kind of question them, yeah, it just opens up your world. That's
Right.
what I found
Mm-hmm.
and find with, the people I coach.
Yeah.
So thank you for sharing that. And I would also was curious in terms of what you do as a preventative cardiologist, and especially as it relates to women, because I know, um, cardiovascular disease is the leading cause of death for women, but most
Yeah.
women, if they think about, what they're most concerned with, I would say most would say breast cancer or cancer. So
Yeah.
how do you, what, what do you find with the people, like the women that you see in terms of,
Yeah, right. I agree. Most women don't realize that heart disease is the number one killer of women. Kills more women than all forms of cancer combined, actually.
Mhm.
So again, just getting that message out, right? Not that something else to worry about, but
Mhm.
something to be aware of. Um, and the other thing that I try to, heart disease is kind of an oddity in that, for when we screen for breast cancer or colorectal cancer, we have these tests that we do to look, right, to image, to look for cancer. Well, in cardiovascular disease, we haven't really had that, right? So we get a standard lipid panel, but we know now that that's only just the tip of the iceberg. Um, but we haven't really had the technology to look at arteries the way we do now, right? So the old way of cardiology was, well, you might get a standard lipid panel and you might maybe get a stress test, but probably only if you were having symptoms. Um, and your stress test to be fine, and people think, oh, I'm great, I don't have any problems. Well, a stress test measures flow limit, looks for flow limiting lesions in a coronary, which is usually 70% or worse. So you can have a 50% blockage in one of your arteries and you're going to have a normal stress test, right? So it gives you sort of this false sense of security.
Mhm.
So now we have different technology. It's 2025. We don't have to wait till somebody has their heart attack to figure out that they have cardiovascular disease. Most heart attacks occur in the setting of a mild plaque that is inflamed and unstable, a so-called soft plaque. That's the old story of someone who had a stress test last week and they did fine, and then they had a heart attack the next week. Well, that's because they had a mild soft plaque that didn't show up on a stress test, right? So that plaque became inflamed and unstable and ruptured, and then they had their acute event. So the key is not only finding the key is finding that plaque before it ruptures or becomes severe, right? So there are several tests that we have now to look at that. we can do a carotid intimal thickness, so measure thickness in the carotid arteries or look for plaque there. We know that correlates with cardiovascular blockage. Or we can even directly look at the heart arteries we can do a calcium score, which measures calcified plaque. That's a great screening tool. And we can even do more in-depth testing like a CCTA with Clearly. So that's a coronary, a CT angiogram. So look at the coronary arteries non-invasively, look inside there for blockage. And the Clearly is an AI software analysis of the plaque. So lets us tell not only, where the plaque is, how bad it is, but what kind of plaque is it? Is it hard calcified plaque? Is it soft, unstable plaque? Is it inflamed? So it gives us great data. And then once we know if you have plaque, then we kind of work backwards, right? Well, so then what does your cholesterol need to be? What about your ApoB and your LP little a and your inflammatory markers? And then how does the diet and the inflammation relate to that, and sleep and stress, right? So again, in my practice, I start with data. I love data, right? So I don't like, the old way again is, oh, your cholesterol is a little high. Here, take Lipitor for the rest of your life. I mean, most people don't want to do it like that anymore, right? So in my mind, the better way to do it, especially in women, because, a lot of the clinical trials in cardiovascular disease are on white men, right? And certainly most of the primary prevention trials. So there's not a lot of data on what to do with women. Well, in my mind, if I can see that either you have plaque on your testing or you don't have plaque, well, then I can help you make a decision on how to address your cholesterol. So maybe if your cholesterol is a little high, but you don't have any plaque or calcium, well, then that's a different person than someone whose cholesterol may not even be as high, but they have plaque in their arteries, right? So the information is important. That's how we personalize care, right? As we know your information, your data, your advanced lipids, your inflammatory markers, and do you have plaque? Then I can take that data and I can make a personalized recommendation based on your data. So that's the way I like to practice medicine, because again, to me, it's 2025. We have the means to collect that data, and I know that's how I, as a patient, right? Mm-hmm. I'm not the kind of patient who's gonna take Lipitor for the rest of my life because my cholesterol might be a little high. I'm not, and I think a lot of people are like that, right?
I totally agree. Yes.
Yeah.
And I think it's amazing now with the new AI technology that's coming out that you can kind of get right into the vessels and plaques like that. It's amazing.
Yeah. It's awesome.
Wow.
Yeah, we get great pictures, and there's nothing like seeing your artery and they lay it out in a nice straight line where everybody can tell what they're looking at, and I can review the pictures with people, and the hard plaque is blue and the soft plaque is yellow, and then flame, that's the worst plaque, it's red. So you can look at it and you can see it. And there's nothing like seeing your own arteries that really helps you decide what to do, right?
Mm-hmm. Yeah, I think most people will respond to something visually that they can see.
Yeah.
What's going on in my body.
Right.
Wow. Amazing.
Yeah, it's powerful. Mm-hmm.
So if you had one piece of advice for a woman coming, who's listening, who's, thinking about making some changes to their health, what would you say to them?
I would start with just sort of an assessment of their health. I think that's a good place to start. So, and again, sometimes it's hard, and sometimes we think we're doing like if they've studied this, if you ask people how much exercise they do, they grossly overestimate it, right? So I think a great thing, and again, we have the technology, is I tell people to get some sort of wearable, to keep a food journal in an app, and to get some sort of wearable. So you can try, and then you just, you keep your food journal for a couple weeks, and you get your wearable and you let it collect data for a couple weeks, and then you look at the data. And it'll tell you, oh, you're eating X amount of calories today, and this percentage is fat, and this percentage is, whatever, and you're not getting enough vitamin C, or right. So you can see again where you need to make some tweaks. And then your wearable data is, you can see, maybe you think that you're getting the recommended 7 to 9 hours of sleep a night, but you start tracking it, and even though you're in bed for 8 hours, you're only getting 6.5 hours of good sleep, right?
Okay, exactly.
Or you're not getting as many steps as you thought you were, or you're having a lot more strain in your life than you thought you were. And it correlates to my commute to work. Is there any way I can have a shorter commute or make that less stressful, right? And so again, it just gives you personalized data to evaluate things.
Yeah.
And I think it's very enlightening, actually.
Yeah, I think that's great advice, just starting with kind of assessing where you are. And
Yeah.
I think it's human nature to kind of overestimate what you think you're doing that's working. I mean, I know I do that with my diet. I generally think of myself as eating a really healthy diet, but I always forget about the little, pieces of, cake or candy that I eat, and it doesn't count, but it
that
actually
stuff adds up.
it does add up if you don't pay attention. So just by paying attention, I think you'll kind of have to address whatever it is that you're doing that maybe not contributing to your overall health. And sleep, again, that's another thing. Like people say, oh, I get 8 hours of sleep, but when you actually look at it, they're in bed for 8 hours, but then they're scrolling for an hour, and then their sleep quality is good. So.
Right. And you might, like I wear a Whoop strap, I can see that, how much deep sleep you're getting and how much REM sleep, right? Because that's the important stages of sleep where we cleanse the brain. So it's just great information, personalized information. And I tell everybody to download the Yuka app, Yuka.
Okay.
That's a great, have you heard of that?
I haven't heard of that one, no.
Yeah, so you scan not only your food, you scan barcodes of your food and your personal care products. And you'll be astonished to see what's in your, food. We can some of that we know already. But your lotions and your makeup and.
Oh, yes. I know.
Yeah.
Yes, you have to be really careful about that.
Yeah, so it's great. It's a great app to check all that. So you download that and you go through your house and you're like, oh my God.
Oh, my family will just love that.
Oh, I know. My kids, my 16-year-old, every time I open my Yuka app, they're like, oh no, we got to throw something else away.
Yeah, they're already, I do that without the app, so I just can't imagine.
Yes. But it's important because, again, that's one of the pillars of lifestyle medicine is avoiding risky substances, right? Yeah. And we think of alcohol and tobacco and vaping, and those are in there too. But the other thing that is in there is all the chemicals we're exposed to. So don't forget about, and air pollution and water pollution. And so again, really paying attention to that.
Paying attention and doing what you can. I always say, like, it's impossible to avoid. There's so many things that we have no control over. And there's so many chemicals we're exposed to every day. You can doing the little things you can to avoid some of the risk, but knowing that you're gonna be exposed to some things you can't.
That's right. Again, small steps, right? So you can't control all of it. But they did a study a few months ago. They found microplastics in people's carotid plaques.
Wow.
So this stuff is in our body and
Yeah.
it's affecting our health. So anything that we can do helps, right?
Yeah.
So again, knowledge is power. Knowing that can affect your health, and then getting something like the Yuka app where you can look at it, and it helps you make better choices.
Yeah, for sure. Well, thank you. This has been a really wonderful conversation. And thanks so
Thank you.
much for coming and sharing your knowledge.
Yeah,
How can
thank you.
people find you if they want to learn more about what you do? And
Yeah. So the best place is my website. That's www.hearthealth.care. And I have free health consultation that I do for people. So you can click that on my website and that'll take you to my calendar. Just to see how I might be able to help you. I'm licensed in several states, so I can talk to you about that. Just whatever people need, I try to figure out how I can help them improve their health.
thank you so much. I'll link your information to the podcast. So if anyone wants to reach you, they'll be able to do that. And any final words you want to say?
No, I would just say that people have we have the ability to control our health, and don't forget that. Don't be discouraged if you already have high blood pressure, diabetes, or you have a strong family history of heart disease. Doesn't mean you're destined to have a heart attack in your 60s like your dad did. There's a lot we can do to reverse heart disease and control it. So it's never too late to try to improve your health.
That's a great message. I love that.
Yeah.
Well, thank you so much.
Thank you.
A pleasure.